helpful. We've got folks over at Streamworks and at ETSU making face masks. That's the one supply item that we've had concerns about, and they've stepped up. We have people all over the region through our interaction with churches. We've communicated with over 200 churches throughout the region in conjunction with Summit Leadership's Church Mobilization Network to discuss with them ways that we can support our team members who have children. We obviously need for our team members to come to work if we are to face a surge. And the volunteerism that's been out there, people that have been interested in trying to help, has been frankly inspiring. 13 churches so far have responded, plus the Three Rivers District of the United Methodist Church, and they plan to share our request for support to the entire Holston Conference. There's a Christian-based camp that's working towards developing programming aimed at children that we want to keep isolated while their parents can work. The YMCA in Kingsport is mobilizing. I know that the Boys and Girls Club here in Washington County, Johnson City, has expressed an interest in using their resources to provide support for children of healthcare workers and other essential workers. So those are great examples of the community coming together, people sewing face masks. That's amazing. And I think as we face a situation like this, people ask, what can I do? People want to contribute, they want to help. Obviously, the most important thing you can do is to stay at home if you don't need to be out. If you are in an essential job or an essential role in the community, whether you're a healthcare worker, a manufacturing job, or sanitary worker, water treatment plant worker, clearly we need you to keep showing up and doing your work. But if you don't have to be out, really, we're at a cusp right now where we're facing either we can slow down this thing or we're going to see it accelerate. As it is now, we have approximately, as far as we can tell, 20 confirmed cases throughout our region. This morning, as Jamie Swift will report to you shortly, we have had some additional cases in the last 24 hours, and I'll let Jamie talk about that momentarily. There's no new information at this point about the reagents that we are anticipating receiving from Cepheid Labs. That's the company that provides us the analyzer so that we can do the real-time lab testing. We are in contact with them daily, encouraging them to release those reagents to us. As soon as we get those, we should be able to move towards real-time testing. As I've said, 50 tests per day, expandable to 400 per day once we get the other analyzer that we've acquired. With no significant changes from 2 days ago with the supplies, we've ordered additional supplies. I think, again, based on what we're seeing in the community, I think that we're in a good shape, with the exception of the face masks, which, as we've already mentioned, there's work being done on that. We currently have 173 available ventilators. That number's up from what we reported before, based on our current utilization. We've seen a dramatic decrease in the use of our hospitals in the last week. Our inpatient surgeries are down close to 60%. Our outpatient volume, outpatient utilization is down 40 to 60% depending on the type of service. Our physicians have heeded the guidance to only provide services for things that are essential based on what the real, true, urgent needs of the patients are. Obviously, that's having a major impact on Ballad Health, as it is health systems all over the country. I don't think that we're unique from that perspective. We've had almost 9,500 calls to our Nurse Connect, and we realize that there are times when you call where we get surges. If there's a time that you call and you have an exorbitant wait time, we ask that you be patient or call back. But know that we're continuing to ramp up our resources at the Nurse Connect so that we can be prepared to handle any situation or any questions that folks might have. A quick comment about, we had a couple questions about our strategy in Wise County. Our approach to preparing for the potential volumes that we might see. We have 3 tertiary hospitals, Holston Valley, Johnson City Medical Center, and Bristol Regional Medical Center. Each of those hospitals has finite capacity for ICU, intensive care, pulmonary services, and obviously ventilator capacity. Our strategy is designed around trying to make sure patients utilizing those high acuity, high intensity services, that they have the ability to access those services. Beyond that need, throughout the region, we are standing up capacity where we need to, so that we have, I'll call it transitionary capacity. If there is an outbreak in Southwest Virginia in the area served by Wise County, we have a facility at Lonesome Pine where people can go, they can be assessed. If their needs are low acuity, we can provide services for them there. If we believe, based on protocols and what we're learning about this disease, that we have a higher risk group of folks, if they're elderly, if they have multiple comorbidities, there's a high degree of likelihood that those individuals would be transferred to Holston Valley, Bristol, or Johnson City Medical Center, because we want to make sure, in the event their condition worsens, as we've seen it can worsen rapidly, we want to make sure they get where they need to be. So we're clear, Ballad Health has the ability, because of our structure, to repurpose facilities and capacity based on creating tiered services based on the acuity of the patients. And we've got a lot of doctors and experts working on that right now, and you know, we're all facing this for the first time, so there's certainly input that folks might have to help us. We certainly would appreciate that, but we need to let our doctors and nurses and clinical leadership develop those protocols so that we can deploy them fairly rapidly. Yesterday, Congress, the United States Senate passed unanimously the CARES Act. We are very grateful for the work that our delegations, both in Tennessee and in Virginia, have done on a bipartisan basis. Senator Kane, Senator Warner in Virginia, Senator Alexander, Senator Blackburn in Tennessee. We've had contact with all four of our senators. I've personally spoken with some of them and their staffs, and I will tell you that the outreach from them has been very helpful. We are still in the process of analyzing the very many different components of the CARES Act, so we can determine how it would impact us and how we can best take advantage of what's been provided for the benefit of our team members and for the benefit of our health system. As I've mentioned, you know, Ballad Health is no different from all of the other businesses in the region from the standpoint that we have faced a massive decrease in the demand for our services, and that obviously has an economic effect on Ballad. Right now, you know, typically Ballad Health, our days cash on hand is generated or is determined based on what our daily spend rate is. On a usual day, Ballad Health spends $5 million a day. That's what we spend. Half of that is spent on labor. The other half is spent divided amongst things like supplies and all the other expenses that it takes to operate hospitals and a health system. And when you're spending $5 million a day and your revenue is decreased by 40% or more, obviously it creates an economic strain on the health system. That's no different than what restaurant owners are experiencing or anybody else whose business has been affected by this. What is different about Ballad and what we have to balance is that we're facing a pandemic, and at the same time we have to deal with the cost of sustaining our services. We also have to make sure that our workforce is prepared and available when and if we need them. And so these are things that are very complicated and are requiring a lot of work and a lot of effort by folks to determine what our needs might be and how we plan to staff for those needs. For the time being, what I can say is this before I turn it over to Jamie. We've had the chance to get out in the field and talk to our nurses and our physicians, and you know, they are heroes. As you're starting to see throughout the country, and even here, this morning as I drove in, I saw a sign outside I saw some signs outside our corporate sign referencing our healthcare workers as heroes. They really are. They expose themselves, even without this virus, they expose themselves all the time to dangers that you or I couldn't comprehend. Infectious disease, people that are facing addiction, people that sometimes are violent. Our nurses and doctors go through things that people cannot possibly understand. And we see it all the time. And so it's, you know, on the one hand, while we want to express our empathy and our thoughts and prayers for all of the businesses, both the owners who have had to make hard decisions and the individuals who are being impacted by those decisions, we also are grateful for the empathy that our community is showing our healthcare team. We are working hard to be prepared for this, and we are we're deeply committed to the health and well-being of this region. And so with that, I would ask Jamie to come up and give an update on the data that she's seeing, and then we'll turn over to Dr. Runnels to give an update from his perspective as well. Jamie?
Our media partners we're covering today. I'm Jamie Swift. I'm the Corporate Director of Infection Prevention. So as Alan said, we wanted to give you an update on our numbers. Right now, reflected on our state websites, we're reporting 20 cases. We can confirm that this morning, as of this morning, Ballad has identified 3 more positive cases in our region. 2 of those are in Tennessee. 1 of those is in Virginia. I know there's some confusion with numbers. Most likely those will not come out on the state websites today. There's usually a bit of a delay on those numbers. So while we're working those cases, it will most likely be tomorrow or a little bit later before you see them actually on the state sites. We really want to stress, I know you've seen in the Tennessee numbers that about half are that age 21 to 40 in Tennessee, and we're seeing that same thing right here in the Ballad region. So of the 11 that Ballad Health has actually confirmed and diagnosed, 8 of those have been in that age range of 21 to 40. And so we really want to stress, as we're approaching this level of community spread, and we're starting to see that, we're really pleading with certainly that age group, but all of our age groups to stay home, really practice this physical distancing. So really changing that from social distancing, which can sometimes make people feel really isolated. I think our focus needs to be on physical distancing, keeping that 6 feet away, staying home, you know, only going out when necessary, essential jobs, to the grocery store when you need to go, really limiting contact at this point. As Alan referenced, you know, we're at this point, we can either really slow this down or we can see it starts to take off from here. So we're asking for your help today and throughout the community as we face this. And at this time, I will turn it over to Dr. Runnels, who is our Chief Physician Executive.
Thank you, Jamie. And I'd also like to thank the media for the coverage that they've given, support that they've given. And I'd like to reiterate what Alan said regarding our team members, our caregivers. They've had a tremendous effort in planning for the pandemic and have done it with a heart for their community, and we really appreciate the work that they're putting in as well. Like Jamie said, we need to take this very seriously. We are at a point where we're at the base of our curve. We haven't seen the rapid upswing with community spread at this point, which we're expecting and obviously preparing for. We've heard many comparisons from various people regarding comparing COVID-19 with the flu, and I wanted to address that just for a minute. COVID-19 is definitely not the flu. First of all, this virus is much more infectious. It also has a much higher rate of serious illness requiring hospitalization or even critical care. And furthermore, this virus has a broader range of symptoms, which makes it much harder to track. Those symptoms can range from people who have little or no symptoms all the way to serious, critical care type symptoms, life-threatening symptoms. So I'd like to reiterate what Jamie said, that it's really important what we do right now. We've never been more dependent on each other for our behavior and our health, and it's really important that you stay home and that you follow good hand hygiene, and additionally follow the recommendations regarding physical distancing. And I think those are our prepared comments, and it's time to open up for questions.
Thank you, Dr. Runnels. And as we talked about on the phone, we're going to go in order, 2 questions each. So right now we have Blake Lipton with WJHL. Blake?
Yes, 1 second here. Are you guys seeing any community spread? And if so, will that change your criteria for testing or anything else that you guys are doing?
Okay, so the question is, are we seeing any community spread? And if we see community spread expand, will it change our criteria for testing? Did I say that correctly, Blake?
That's correct. Are you guys seeing any community spread?
Well, there has been yes, we're starting to see evidence of a little bit of community spread. As we see that occur, we obviously notify the health department. We're obviously working closely with the health department. Then what they do is they will trace the individuals who are affected so that they can contact any of their contacts again, to try to contain it. So there's a lot of efforts from an epidemiological perspective that are being deployed to prevent spread when we do find it. But the answer is yes. As Dr. Runnels said, that's a great way to put it. We're right at the base of that curve where we're starting to see it. You know, initially, most of the cases, well, all the cases we were seeing initially were cases where people had traveled and come back. Obviously, that now lends itself to contact that those individuals may have had, which then creates spread within the community. So that's where we're at. As to the criteria, we're going to stick with the CDC guidance, and I think that's really the best place for us to be right now. Based on what we're seeing in terms of the testing, the number of tests we're doing versus the positives that we're seeing, it seems that we're catching those that are calling and asking to be screened. So the process right now seems to be working. Obviously, there are limitations. The limitations relate to the things we've talked about: supplies, personal protective equipment, and balancing those different issues. I think our situation will get better once we have the reagents that we need to do the live results turnaround here. And we were expecting to have those reagents this week. We do not yet have the reagents. We are certainly in daily discussion with the lab company because we do think that will help us.
Blake, do you have another question?
Yes. Have you designated a Northeast Tennessee hospital for coronavirus?
Well, we are working on that. The answer is yes. We're not prepared to discuss that yet until we have our plans in place. We also have one for the Southwest market. Again, the approach is folks that are lower acuity that present, if we can do everything we can to keep the strain off of the major tertiary assets where we have the most resources, that's our objective. Now, by the way, I should say, just because we have those resources at Holston Valley, Bristol, and Kingsport, that does not mean we do not have those resources at other hospitals as well. For instance, Johnston Memorial in Abington's got a very highly functioning ICU with pulmonary support, and some of our other hospitals do as well. So we're taking a systemic approach to this. And when we say it's a COVID hospital, we want to be clear. It's a first stop transition towards making sure we assess people and get them to the place that's appropriate. Lower acuity patients that can be treated closer to home, that's better. But when you face people who have high acuity needs, where you need much more intensive support from physicians and nurses that are better trained for that, then those are the cases we're going to try to get to the higher acuity facilities. But right now, I can tell you, Holston Valley, Johnson City Medical Center, Bristol Regional Medical Center, Johnston Memorial in Abington, to some degree Indian Path, these are hospitals that have a history of running pretty high intensity intensive care units with good surgical programs. So I think that we have the capacity there to be able to do the proper handoffs.
All right, thank you, Blake. Now we have Taryn Young with the Coalfield Progress.
Yes, I am calling out of Wise County, Virginia. There's a lot of concern about what's going on at Lonesome Pine. Can you go into more detail about testing? Is there drive-through testing, and how many cases or potential cases you're seeing coming to Lonesome Pine Hospital?
Yeah, we are doing drive-through testing in Wise County. Right now it's at Norton, correct? Mm-hmm. Yeah, so it's at Norton. Again, the reason we've done what we've done there is there's work that has to be done to again, we haven't started to see a surge. It's important that the work we're doing now is for the purpose of preparing in the event we get a surge. So there's work right now being done with the leadership of Wise County, the CEO there, Mark Leonard and his team. He's got a very good team working in concert with our infection prevention staff as well as our physician leadership at the ballot health level. They're working right now on developing their clinical protocols. That's the process that's playing out right now. What I would ask people to do is be patient, let them do their work, And as we develop our strategy, we will definitely communicate that. So right now, there's nothing for folks to react to. Let our clinical team do the work they need to do so that we can be prepared if and when we get a surge. This is all about preparing. We're not facing a surge right now, but we are putting resources and pieces in place so if we get a surge, the time to fly the plane is not, the time to build the plane is not while you're flying it. You want to build the plane before you have to fly it, and so that's the process we're going through right now is we're sort of building the plane. So just give us a few days to put our clinical protocols in place, work with our staff, educate our staff, do the proper training with our staff, and then we can have some more detailed discussions about it in the coming days.
Taryn, anything else?
Also with the demographic of the community here, what cost can patients expect for treatment for the virus if they're uninsured?
I'm sorry.
Cost of treatment that patients can expect.
Well, so again, in Virginia, there's a different situation in Virginia than there is in Tennessee. Virginia has done the Medicaid expansion. So folks who are low income, below I think 130% or so of poverty, qualify for Medicaid, and we will certainly help get them enrolled if they need that coverage.